Hello, listener. This is The Way In, a podcast about finding our way through the often impenetrable worlds of psychotherapy, psychiatry, and psychoanalysis. I'm your host, Tyson Connor. I'm a psychoanalytic psychotherapist and clinical supervisor in Washington State. Each episode of this show, I talk with other mental health professionals about the work they do and topics they care about, using language that you don't need an advanced degree to understand. Come join us as we try to find the way in. And today, on our very first episode of The Way In, listener, this is your introduction episode. This is your orientation. This is the first day of class where you just go over the syllabus, sit in the back of the class, and try to figure out which of these people are going to be my friend. Hopefully all of them. You've heard my voice already. I've introduced myself already. I am Tyson Connor. I am the host and producer of this podcast. And on this episode, I am joined by the other creative forces of this show. Sitting right next to me here in the room with me is my good buddy, Ben Lewis.
I just realized I'm in the wrong homeroom.
Yeah, this is not your field of study. Your degrees are not in any way psychology related.
Nope. This is not my area of expertise, but it is an area of interest for me, and I'm really excited to be involved in it.
Yeah.
In some way.
Listener, Ben and I have been friends for a long time, since college, and Ben makes the music for this show. Ben and I had...
That's exactly the word for it.
Yeah. There's another podcast that Ben and I talk on a lot. It's called Trash Food for Garbage People. Feel free to find it. If you are a client of mine, maybe have a conversation with me before listening to it, because it's more of a comedy situation.
It's much sillier in every way.
Yeah. And you know, some comedic choices can be regretted at times, but Ben makes the music for this show and got me into podcasting in the first place. So without him, this show would not exist. And then also joining us from across the state is Dan Lane. Hi, Dan.
Hello, everyone.
Dan and I have also been friends since college, and Dan's contribution to the episode is the show art, and also he will be producing individual episode art. So for each of the episodes, we'll have its own little sort of cover art piece that Dan's been working on.
I just wanted to say, before we get into everything, that yeah, me too, I'm interested in this stuff, have been for a fairly long time at this point, but have no formal training or anything like that. Mostly everything I've learned has either been through osmosis, friendship with Tyson, or the internet, or podcasts. So the blind leading the blind out here. Excellent.
Yo, we're just trying to find a way in.
Hey.
Exactly. Yeah, so, you know, I'm a layman in all of this stuff, but have a deep curiosity for it. A lot of it stems from the fact that I've had my own experience with the mental health field, having a time of acute negative mental health in my early 20s, and it kind of does color the rest of your perceptions through life after you've gone through it. Mine was like a form of talk therapy and mostly like mindfulness, meditation modalities. Might be getting ahead of ourselves with terminologies there, but I'm sure many of the listeners have experienced something similar. And I just wanted to give some background on where I've even brushed with these topics and these kinds of things.
Mm-hmm. Mm-hmm. Yeah.
And and the art. And the art's really fun. And I think psychoanalysis is like a perfect way into doing art and perceiving art. And I think that's part of the reason I'm so interested in doing that, is just it spurs on so many cool new ideas and frees me from the mind prison that is every other kind of art I've made in my life.
Yeah. Thank you. That's who these guys are. And we're here to have a conversation about this show. If you're mostly here for the content, honestly, you could probably skip this one. But Dan is talking about psychoanalysis, right? And so, let's define our term.
Define that term.
Bum, ba, bum, ba, dum, bum. And you would have just heard a bump that Ben made. So psychoanalysis is probably a term that most folks have heard. Psychoanalysis is a modality. There's another term I'm going to define. play the bump again, define that term. Now they're nestled into one another. A modality is a particular way of practicing specifically psychotherapy. So cognitive behavioral therapy, dialectical behavioral therapy, internal family systems, EMDR, psychoanalysis. These are all different modalities. And psychoanalysis is a particular modality that is one of the oldest, arguably the oldest in psychotherapy. The sort of founder of modern psychology, Sigmund Freud, who we'll talk a little bit about later, the thing that he started, he called psychoanalysis. And I agree with Dan. Psychoanalysis is a way of thinking about a person's mind that is really useful to apply to other areas of life in the world. Psychoanalytic theory really informed a lot of literature theory. So if you're interested in any like media criticism, right, a lot of that stuff is heavily influenced by psychoanalysis, as are other important intellectual traditions. So I practice psychoanalytic psychotherapy, and we'll talk about why I didn't just say psychoanalysis in the future, but and I find it really interesting. So this feels like a good segue into this specific show, why I'm doing it and where it's coming from.
Yeah.
So one of the things that I ask everybody on this show is all theory is autobiography on some level. So this is like the autobiography of this show. So you can understand the theory behind this show. So I practice this form of therapy. I like to read the literature that's in my tradition, and a lot of it uses really complex, very specific language that can sound like psychobabble, and it kind of is. And I was talking with Brian Pendergast, who will be a guest later on in the season, about that idea. And we were both talking about how we think that the ideas of psychoanalysis aren't actually that complex. That we use complex language to talk about them. We use specific language to talk about them. But really, to get the idea, you don't need all of this background and history and complicated specific language. It's actually pretty accessible. So this show is in many ways an outgrowth of that conversation. At the time, I was working at a group practice, which is another way of just talking about a private clinic with a lot of practitioners there. While there, I got a podcast started with a very sort of similar idea of trying to demystify psychotherapy, trying to talk about these things in accessible language. I left that group practice, and now I'm still interested in this. So I'm starting this show because out on my own, I'm still curious about these same ideas. So
I had a question.
Yeah,
If we're still doing the psychoanalysis definition stuff.
for sure.
I've heard it like described, I think, fairly well as like a tradition of thought.
Yes.
Because there isn't necessarily one correct form of psychoanalysis. It's more like a group of ideas that have been added to and developed over time by a different set of practitioners and whatnot, and people who write the literature and stuff, and then people who refer back to the theory and then apply it in different ways in their own practice. So it's kind of like this library of concepts, knowledge, recorded events, and things like that. And I think that one of the things that you're kind of talking about, the difference between psychoanalysis and psychotherapy, or what that difference kind of is. And I feel like that can be hard to pin down when you're first hearing people talk about this stuff. Even over time, I always kind of have to remind myself what the differences are. Correct me if I'm wrong, but my basic idea, because you're talking about how it's relatively simple, if you get down to sort of the bedrock foundational concepts, psychoanalysis is a little more exacting with its definitions and its actual, let's say, rule sets or methods. And that's simply because it comes almost directly from let's say a Freud or a Lacan or someone who's writing these relatively dense theoretical texts, right? Psychotherapy is looser. Am I wrong in saying that?
No, that's absolutely correct. There's kind of like two different ways I use the word psychoanalysis, right? So way one is talking about a collection of ideas, right? So psychoanalysis as a collection of ideas or as an intellectual tradition is like the theory, the concepts. And we have a lot of episodes talking about the theory and the concepts. And then there's psychoanalysis, the practice, right? So the practice of psychoanalysis is a lot more rigidly defined and rigidly held. It usually has rules about meeting very frequently, laying down on the couch, practicing free association, other kind of techniques of how you work as a therapist and as a patient in psychoanalysis. Psychotherapy is sort of an umbrella term that covers a lot of different techniques and ways of practicing mental health therapy. All right, psychotherapy and mental health therapy mean the same thing. And psychoanalysis, some people get mad at me about this. Psychoanalysis is a form of psychotherapy. Some people will say, no, psychotherapy is a lesser thing. Psychoanalysis is separate. No, those people are a little funky. One of the things that this show is actually trying to combat is that historically, psychoanalysis was really, really strongly gatekept, right? Like until the 90s, you couldn't become an analyst unless you were a medical doctor first. You had to be a psychiatrist. And then there was a full-on lawsuit to say, let people who aren't psychiatrists study this thing in America.
Right.
Even then, you know, for a long time, psychoanalysis and institutes where you trained to become an analyst wouldn't accept people who were gay because that was considered to be pathological or like perverse. Psychoanalysis still has problems with all the same systemic problems that American culture has, psychoanalysis has, around race, around gender, sexuality, income, And for a long time, being a psychoanalyst and someone who practices psychoanalysis was very protected and very prestigious. And so there was a little bit of like, oh no, don't let people access this unless they're worthy, kind of. And some of that, there's a lot of reasons for that. And like the history of psychoanalysis is pretty complicated and pretty interesting. But part of what I think is that ideas of psychoanalysis can be really useful for people trying to live their lives well. And I want to talk about that in a way that people can make sense of for themselves.
Well, and the gatekeeping thing totally makes sense with all the psychobabble you were talking about.
Right.
That's part of it. I come from an engineering background, and so that's also a thing in my field because for most of mechanical engineering, the question is like, how big this box need to be?
Right.
Or like, how hard we need to push on this so don't fall down. Like, you can explain the concepts very simply, but you use shorthand terms like, vectors and like moment of inertia and like all these things, or like id and not like where thoughts live.
Sure.
Like,
Yeah.
you can explain all these things, but part of making yourself feel special as someone who has done a lot of study is using big words that you can make test the person you're talking to see if they understand a big word you use.
Right.
And so I feel like this podcast is like a super valuable type of thing to be like, no, these actually aren't that crazy of a concept. Like how big box need be.
Right.
Or like where thoughts live. Like,
right.
Everybody has them.
Right. Yes.
They live somewhere. Let's talk about the house thoughts live in. Like, yeah, we can talk about that. You don't need the big words.
Exactly. And as an engineer, you will also know that when you're in the situation where you're trying to solve the problem, how big does this box need to be?
Right.
You need to know all of those things and what they mean. The specific meanings of those big words are very important when you're actually practicing the thing, but they're not as important when you're trying to explain to somebody what it is you do for a living.
Exactly.
And that, I think, is the gap I'm trying to fill a little bit. Like the person I have in mind when I'm recording these episodes is my mom. Hi, Mom. I know you listen to this. Part of it is because she's like the only person who I can predict is absolutely going to listen to it. And the other reason is that my mom is a very smart person who like never went to college. She went to high school and then she like lived her life.
Right.
So she never took a lit theory class where they talked about Freud, but she also gets life and knows how to understand it and how to live it. So my goal is to have a conversation that makes sense to her. And after these episodes come out, we talk about it. And I ask her, hey, did that make sense to you? And if she says yes, then I know I've done a good job. Like, that's my goal. So in the intro, you heard me talk about the things we're going to talk about on this show. We're going to talk about psychoanalysis. We've already started that conversation. We're going to talk about psychotherapy. Already started that conversation. We're also going to talk about psychiatry. And a lot of people get confused about these terms, but psychiatry is a word for medication prescription and using medications to help people with their mental health. So most psychotherapists are not psychiatrists. And there are many psychiatrists and prescribers who do not practice psychotherapy.
Right.
Back in the early days, they were one and the same. Everyone who did therapy was a medical doctor who was trained to also use medications. Today, that is no longer the case. Mm-hmm. So there are an awful lot of people who are very well educated about therapy and analysis and how to practice these things who don't know a damn thing about medications. I didn't want to be another one of those because so many people are using them. So many people have used them. And because in my conversations with psychiatrists in the past, I think that a lot of psychiatry kind of works a lot like a lot of therapy, where there are big words, there is specificity, but also we can talk about how a body works and explain things in an interesting way. So that's more or less what we're going to be talking about. Now, I'm going to talk a little bit about how I structure these episodes and how I structure my interviews, because I've done it very intentionally. And I'm going to make reference to these things in future episodes, and I'm not going to explain it. So this is your one chance to get it explained.
You only get one shot.
Exactly. So the first thing is the outline. Throughout this season and future seasons, if I make them, you will hear me reference the outline. When I started the podcast at the last place, there were a few recordings that went really off the rails. We started talking about thing A and we ended up on thing B and C and D. And I was wondering, like, okay, how can we avoid this? Because I'm just really curious about stuff and I like explaining things. And so what I've done is I ask all of my guests to write an outline for me of what they're prepared to talk about. And I've had outlines that were like, 4 bullet points. And I've had outlines sent to me that were 6 pages long, right? Different people prepare at different levels.
Right.
And part of what that means, listener, is like my interviewees, who I call guides because we're trying to find the way in because I'm clever as hell. We'll use guest and guide interchangeably, and it's a little cringe, but also cringe is just another word for earnest, and I'm going to be earnest as hell.
Love that for us.
Yeah. My interviewees, they've done the work. They did homework before being interviewed by me. Like, this is not a easy podcast to be on. So I'm very grateful to them for even doing that. And I find that the outline really helps me know what kinds of questions to ask, where to slow down, and what things that might get referenced that it's good for me to skip over, because that's not what we're prepared to talk about. The other thing that I ask all of my guests for are further learning and plugs. So further learning would be like, we've had the, when I first started this show, I was like, each episode will be like, 40 minutes to an hour long. No, dude, they're all like an hour and a half. I can't, it will not surprise either of you that I can't shut the fuck up.
Well, they don't feel like it. So I've always thought like that was about 45, 48 minutes maybe. So if you're going over, then I don't even notice it.
I'm going very over, Dan. So I appreciate that. That's good to hear that they're compelling. The people who I'm interviewing have like done a lot of learning so that they can even have the conversation that I'm having with them. And so the further learning is a place for them to A, cite their sources, and B, direct folks who are interested in learning more. Mm-hmm. So that'll be books, YouTube videos, other podcasts, movies, blogs, you name it, all sorts of resources, mostly books because, people like books. And then also anyone I'm interviewing, I want to give them a chance to plug their stuff. So I've got authors on here, psychotherapists, teachers, supervisors. So if they have something to sell, because capitalism is how we live, then that'll be listed there. Now, where is there? Good question. That's in the show notes. I will reference the show notes so much on this show, listener. And when I say show notes, what I mean is all of the text and links that come associated with the podcast. If you're listening on Apple Podcasts, go to where the episode is listed. So if you're playing the episode, that doesn't work. You actually have to go to where the episode's listed. And there underneath the title of the episode, you'll see a brief summary. Click those 3 dots, click go to episode, and then there you go. There you'll have all of the information and all the links.
What a Byzantine way to set that up,
Yep,
Apple.
Yep, that's real messy. On Spotify, it's actually pretty easy. On Spotify, when you play the episode on your phone, you just scroll down to about the episode. That's where all of the show notes will be. If you're using Overcast, you just tap on the album art. If you're streaming this on SoundCloud, then it'll be on the individual episodes page. Every place will have it in a different spot, but it should be accessible. If you want to get the most out of these episodes, I highly encourage you to go and look at the show notes because there's good shit in there.
And that's just a good thing to know. A lot of podcasts have a bunch of stuff in the show notes.
Yeah, actually.
If you're not already using it, you might be missing out on a bunch of stuff if you listen to other shows. So
yeah, especially educational shows.
Oh, for sure.
They will put a lot of further resources in the show notes. All right, so that's how I set up the show. Now let me talk a little bit about this specific season. So this is the first episode of season 1. This is the first of 12 episodes. They'll come out every other week on a Tuesday morning. And I kind of have the season divided up into like micro series. And these series usually have 2 or 3 episodes in them. The first one is psychoanalytic theory. So we've got a few different episodes talking about psychoanalytic theory, starting with an episode just about Sigmund Freud. Hello, listener. Editor Tyson here. You'll hear me popping into a lot of these episodes because after I've recorded an episode, sometimes when editing, I'll notice that I forgot to say something, or I said something wrong, or I need a correction. And that's when Editor Tyson gets to show up. You can recognize Editor Tyson because he's usually mixed to be balanced equally between the left and right channels on this stereo audio file, and the sound quality is slightly worse. I'm jumping in here because I didn't actually finish talking about the totality of this season when we did the recording. Ben asked a question that got me excited and I followed that rabbit trail. So I just wanted to wrap up that idea that I didn't quite finish. This season on the way in, as I was saying, we have a few different micro series made up of 2 to 3 episodes each. And I'm just going to give you a rundown of what to expect from this season. So our first micro series is about psychoanalytic theory. As I just mentioned, starts with an episode on Sigmund Freud with Daniel Benvenisti, followed up by an episode on the use of psychoanalysis in times of crisis with Carol Poole, and then an episode on the category of moral injury with Sherry Nicholson. After that, there's a couple episodes on psychoanalytic psychotherapy, more about the technique, a little bit less of a high-level thing and more focused on the practice itself. And in those 2 episodes, we have one on narcissism with Brian Pendergast, and another one on the limitations of empathy with Grayson Moody. After that, there's a couple episodes that I'm calling our social justice micro-series. The first is on depth therapy for trans people. That's with Cameron Boyson. And then an episode on body positivity and fat liberation with Hannah Knapp. After that is our micro-series that I'm calling Off the Couch. It's 3 episodes about ways of practicing therapy that aren't just sitting in a room talking between therapist and client. So the first of those is an episode on the protocol for MDMA-assisted therapy for post-traumatic stress disorder with Aaron Wright. Followed by that is an episode on psychoanalytic equine therapy with Kelsey Watkins. And then the third in that series is the use of tabletop RPGs and psychoanalysis, specifically Dungeons and Dragons and psychoanalytic therapy. And that's with Kevin and Catherine Clevier. And then finally, to wrap it up, we have a single episode micro-series, which perhaps I should call a coda instead. And that one is on medications, specifically medications for ADHD. And that's with Matthias Massaro. So yeah, that's our season. That'll be 6 months of episodes. That's what you can expect. Listener, that more or less wraps up this orientation to what this show is and how it's set up and structured. My conversation with Ben and Dan after this, I think, is interesting and fun and is a lot more about the philosophy of the attitude that I'm bringing to the show. So if you wanted more of the practicalities of the setup, what to expect and how it goes, you can stop right here. But if you'd like to hear us talk a little bit more about the philosophy and worldview that I bring to psychotherapy and to this podcast, then feel free to keep listening. Regardless, I hope that you find the season enjoyable. Editor Tyson, out.
Why is it that you're starting with Freud, would you say?
So, We're starting with Freud for a couple reasons. The first is because I think there's a lot of misconceptions about Freud. The episode itself is almost equal parts about what did Freud say and also why does he have such a bad rap? Which I think is an interesting conversation. And because going with this theme that we have throughout this season, and I think throughout this show, that all theory is on some level autobiographical, the story of a intellectual tradition is oftentimes the story of the people who built it. The story of their founders are significant to the story of that intellectual tradition. And that's true whether you're talking about a philosophy or a religion. The person who founded the way of thinking and how they were in the world is pretty important.
Right.
And Freud founded psychoanalysis. He also founded psychotherapy. Talk therapy didn't exist before Sigmund Freud.
Right.
We had people doing hypnotism and stuff, but not talk therapy as we know it. And he's a really interesting dude. And the stereotype of Freud that we get culturally really does a disservice to how important his ideas were.
Right.
I wouldn't necessarily say any of them are outright false. But a lot of those criticisms and critiques exist because of how transparent he was as a person.
Right.
And when you see through a person, you're going to see stuff that's not great. So yeah, that's why
Do you want to talk more about all theory is autobiography?
Yeah.
I feel like there's a lot to unpack there.
Yeah, there is. The basic idea of it is that ideas about how the world works really are ways that we make sense of how our lives have worked. So theories about how the human mind works really is how a person makes sense of how their mind and the minds that they've experienced work. So in that way, you can't really separate theory from biography. If you've ever had like a college professor who was like a specialist in a particular writer or a particular philosopher,
Right.
they probably also were basically a biographer of that person. They knew the details of that person's life and how they intersected with the things that they made and said. That's one thing. It's just a philosophical position that I have.
Okay. Well, I feel like that spills over into a lot of other areas. Like you'll see that a lot with people who study diseases are often like people who either suffered that disease themselves or are related to someone who has, or people who study all sorts of things are like impacted by that thing.
Yep.
It reminds me of the lyric, a glass can only spill what it contains. Like,
Right. Yeah.
the things that you think about and make up are the things that have been put into you throughout your life by your experiences and the people you interact with.
Exactly.
Yeah, it's a really cool thought.
I enjoy asking my guests that question, like with that in mind, like how did you come to this idea or topic? Share some of your biography so that we can understand your theory, basically. Part of the fun of that for me is it takes these what could be like dusty and, you know, technical and clinical, like sort of sterilized ideas and gives them a little bit of flesh and blood. I'll put this in the show notes, listener. But one of the psychoanalytic therapists who I really like, his name's George Atwood. I don't actually know if he's still alive. If he is, he's pretty old. He wrote a series of blog posts called There Must Be Blood that are pretty visceral. They're pretty intense. Just like heads up, if you learn it, this is a therapist who worked with a lot of traumatized people and he talks about that trauma. So like, if you don't want to deal with that, then like, yeah, don't read it. But his whole point is that the way we talk about our work can sometimes desensitize it to a point to where it's like sterile and unapproachable. But we are living creatures living in a real world. And so we will have blood. When I ask an interviewee, how did you come to care about this topic? I'm essentially asking, where's your blood in this? Where's your blood in the game? Because we all have blood in the game. So where's yours? And then the conversation gets to get started from a very lived place. It's more affectively driven than less
Is that another
intellectual.
way to say like suffering? Where's your suffering in this?
Not necessarily. It's more of like, where's your experience?
Where's your passion?
Yeah. Suffering will often be part of it. You know, the root of passion is suffering, right? Compassion originally meant suffering with, right? I know people who prefer to call their clients patients because the patient is the one who suffers, right? And suffering is absolutely a part of it. But when blood is present, it could be evidence of suffering, but it's absolutely evidence of life. Most of the blood that's in me is not ever a part of suffering. Most of it's just a part of my daily functioning.
Right.
And when you're talking about psychotherapy, yes, there's suffering behind almost everybody's story on some level. Even if that suffering is just a feeling of isolation and loneliness, that drives a lot of therapists. A lot of therapists were very lonely people, and their interest in psychotherapy was a way for them to try to understand, how do I make contact with anybody? A lot of therapists are people who have suffered a lot, and their interest in therapy was how to survive in a world full of suffering. But everyone's story is particular, and that particularity is really interesting to me.
Does this particular psychoanalytic term relate, resistance? You've heard the term resistance.
Yeah.
Are you saying, would blood usually coincide with like a certain amount of resistance potentially in like a person?
Potentially, yeah. So in the world of psychoanalysis, the idea of resistance is, let's say that you have a psychological symptom of nightmares, right? You're having nightmares. And you come and talk to your therapist about it. And your therapist says, I've noticed this theme in a lot of your nightmares. And I'm wondering if this is maybe connected to like something really awful that happened to you when you were very young, because it sounds like this might be a memory. This could be a traumatic memory that you're reliving in your sleep. Resistance is all of the psychological stuff, mechanisms, tactics, techniques that your mind might come up with to avoid engaging with that idea. So that could be anything from like, no, if something like that had happened to me, I would know about it, right? That's denial. That could be just the fact that it's coming in a dream and not a memory is in itself a kind of resistance.
Right.
You're repressing at that point.
The memory was painful enough that you kept it from being a conscious memory.
Exactly.
Your brain pushed it down.
And that's what repression is.
Yeah.
That right there, that's repression. If you've ever heard people say they're so repressed, that's what they mean.
Right. Which is a form of resistance.
Yes,
Okay.
exactly.
Yeah.
And it's not a choice that's made. It's just part of how a mind works.
Right.
And so in psychoanalysis, something that we've been saying since Freud is you don't fight resistance. This is one difference between an analytic approach to therapy versus a cognitive behavioral one. In a behavioral therapy, you change your behaviors. You put on your shoes and you go for a walk, and that'll help you feel better. And you know what? That does work. That's true. Like, they're right. And in a psychoanalytic therapy, we want to know, if you know that stepping outside is going to help you, and your shoes are right there by the front door, but you just sit there staring at them, what's that about? Why don't you want to put your shoes on? What's the resistance about? We don't fight resistance. We're curious about it. We want to understand it and see where it comes from.
Would you say that another way to describe it would be like an unconscious motivation to avoid something?
Yeah. Okay. So this is where we get into some of my theory stuff. My psychoanalysis that I'm most interested in is what's called relational psychoanalysis. And more it's called contemporary relational analysis. And maybe eventually the relational will go away completely and it'll just be contemporary analysis. And part of what I like about it is, number one, it's inherently an integration. There were a bunch of different psychoanalytic schools of thought. You can think of them like denominations of a church. Like Catholics and Southern Baptists might not believe very much of the same things, but they can have a conversation because they share so much history, theology, and sacred text, right? Similarly, let's say an interpersonal psychoanalyst, which was a school of psychoanalysis from New York that was big in the 60s, 70s, and let's say Lacanian, which is a school of psychoanalysis from France at around the same time, would not be interested in the same things, really. They would practice very, very differently and would believe very different things about human beings, but they could talk to one another because of the shared history, because they both had used a lot of the same language, but in different ways. The relational turn happened when a bunch of guys in New York started reading a bunch of people from these different psychoanalytic schools and integrating them, trying to bring all of it together, trying to say, actually, these different schools are in conversation with one another, right?
It's the mixed martial arts versus
Absolutely, actually, yes.
The karate versus judo versus
Yeah. Yes. Contemporary relational analysis is the MMA of psychoanalysis. Hot damn, I'm using that. Okay. But one of the things that I like about a relational analysis is the ideas around different self states and dissociation. So the way that we think about it is that oftentimes the things that a person is resisting is a kind of integration. We think of a person as being made of bunches of different parts of self. And some of those parts get held at arm's length. A lot of those parts feel very close to the center of who we are. If you're familiar with internal family systems, if you have a therapist who practices that way, it uses a lot of the same ideas.
What are some examples of these like parts of self?
Yeah, well, so in internal family systems, it's pretty well organized, and they talk about, the firefighter and the exile and things like that. In relational analysis, we kind of borrow some of those ideas from like Freud even. Mm-hmm. Like we will talk about a superego, which is another way of saying the part of you that knows what you should do. And so we can talk about like a persecutory superego, which is like when the part of you that knows what you should do beats you up for not doing that thing, right? I'm looking at my shoes and not putting them on. If I have a persecutory superego, then I'll think I'm a total piece of shit because I'm not putting on those shoes to step outside.
Right.
I'm terrible because I'm not going outside, right? If I have a weak superego, then I might see those shoes and I might go like, meh, I don't want to. And some part of me, maybe way in the back of my mind, might be like, I should put on those shoes and go for a walk. But it's quiet.
So superego is just kind of a synonym for what most people would call their conscience.
Exactly.
Okay.
Yep. Other parts of self that exist, though, are like the person that you were at age 6 is still inside of you.
Mm-hmm.
Oftentimes, we can like bring that person to mind. We can think about that person. Sometimes we can feel like we're that person again. If you've ever had the experience of like, it's a certain time of year and all of a sudden you hear a song that you listened to in high school and then boom, you feel like you're back there.
Mm-hmm.
That's your high school self state kind of coming up, right? So there are lots and lots of self states inside of a person, including self states that we don't really know what to do with. Maybe there's a part of me that was traumatized. And I don't know what to do with that. Mm-hmm. So I forget it. I repress it. I resist it. Maybe there's a part of me that's really fucking mean. That's really sadistic. Mm-hmm. That likes when I can get one over on people, when I can make someone hurt. And maybe I don't like that about myself. So I try to pretend that part of me isn't there.
Right.
And so it also is denied and kept separate. The theory that I work from essentially argues that when different parts of yourself are kept separate, aren't accepted, aren't invited into that internal conversation, it causes trouble. So we try to integrate. We try to pull those pieces together. And one thing that I try to do on this show is pull the pieces together of like whatever it is that the person is talking about. I'm trying to make it accessible. Not something that's just, I don't have to think about that because it's too smart, right? Like it's too clever. It's too far away. No, like this stuff is accessible. This stuff is relevant to day-to-day life. And these shows try to get at that.
Right. The metaphor that springs to mind is like if someone was born with like an extra finger on their hand or something like that. They might hate that part of themselves.
Right.
And they might try to like
pretend it's not there.
Like it might go so as far as like try to distance themselves from it. They'll like wrap a string around it to cut off the circulation. But like if you do something like that, you could kill the finger and then get gangrene, and that could kill you.
Yeah.
Like, not allowing that part of yourself to be part of yourself.
Right.
Can cause serious damage to the whole of you and not just the part of you that you're trying to like separate yourself from.
I'm almost positive there's probably like some ritualistic traditions where when someone's like lost a limb or been through like a horrible experience, there's some kind of way that they reintegrate that. For your example, like a loss of a limb or a loss of family or loss of a place, setting, home, something like that. Like that all sounds very within the same sort of line, like just your thought experiment. There's probably thousands of examples in different cultures.
I'm sure.
Yeah. I was recently talking with someone who is a therapist who is in Australia. And she was talking about how one of the things that the Australian therapists had to figure out how to do was that some of the Aboriginal cultures in Australia have this thing where if someone dies, then their loved ones will cut themselves, like as a way of mourning the person's death. And for decades, therapists would be like, you're self-harming. That's pathological. We need to get you to stop.
Right.
But actually, that spilling of blood was an expression within their culture of grief and mourning and loss.
Right.
I bring that up for a couple reasons. One is because when talking about how people work, you very quickly can go from the personal to the anthropological, where you go from talking about a person's mind to talking about the way that people are in all places around the world, right? And so culture becomes very important because culture is one of the things that helps us define how to make sense of stuff. Psychoanalysis itself is often referred to as a culture. People have argued that to learn psychoanalysis, you actually need to acculturate to psychoanalysis. You can't learn it from a book. You learn it from being in the community. I think there's some truth to that.
Right.
This show is meant to try to bring people into that a little bit. And also to speak to the embodiment piece. Psychoanalysis and Western society is very much interested in separating the mind from the body. It's trying to say that the mind is one thing and the body is another thing. But it's just not true. And the way that our minds work play out in how we relate to our bodies and vice versa. So like bodily analogies and like metaphors are very accurate. For example, the idea of having a gut feeling about something.
Oh, yeah.
On the last podcast that I did, we did an episode on the most common form of antidepressant, which is an SSRI. Stands for selective serotonin reuptake inhibitor. And it's a drug that uses the neurotransmitter serotonin to try to help alleviate symptoms of depression and anxiety. And serotonin exists in the largest quantity in the brain and in the second largest quantity in the GI tract, the stomach and the intestines. And then the third largest quantity in the genitals. So whatever it is that's managing our mental health has an awful lot to do with our gut and an awful lot to do with our genitals. And that's something that's a little bit awkward, but like that's part of being a human. One of the things that societies do is they give you ways to separate off parts of yourself so that you can fit in. And one of the things that I want to do is try to use psychoanalysis to try to accept the parts of you that aren't allowed to fit in elsewhere so that you can feel more comfortable in your own skin. That's an idea I stole from Daniel Benvenisti, who... Daniel, I'm so sorry for mispronouncing your name on so many episodes of the show. Most of them were recorded before we spoke. I'm so sorry. Benvenisti. But that idea is one of the things that he talks about, trying to help people feel more comfortable in their own skin. Yeah.
I don't know if this really relates, but I just wanted to say, no, I thought that was a really good example, Ben, because it reminded me a lot of, you guys have seen the film The Elephant Man by David Lynch?
I still haven't.
I haven't either.
I know you're a big Lynch guy.
I know of it, but I haven't seen it.
The point would be that that's an example of a society that does not know how to integrate someone who is othered or is seen as pathologized in the community.
Yeah.
And I will use that as a segue to talk about the term pathology. I feel like that relates to all of this and comes up essentially anytime you're talking about symptoms, something potentially going wrong in someone's mental health. So can we talk about what that is?
Yeah. So I'm currently reading a book on psychoanalytic diagnosis. That's what it's called. Psychoanalytic Diagnosis by Nancy McWilliams. Check the show notes. And so I have some thoughts about this in my mind. So let's define the word pathology. Or pathological is another way that it comes up. To say that something is pathological is to say that that thing is a problem, is causing trouble. A pathology is the way that something causes trouble. A pathogen is a germ or a virus or a particularly insidious idea or way of being in the world. So in the world of medicine, a pathogen would be the COVID virus or a gangrenous bacteria. In the world of social welfare, a pathogen could be a strongman or a bias or a stereotype.
Or a dangerous idea or a conspiracy theory.
Right, a prejudice.
Like incels or
yes,
something.
or incels. Yeah. In the world of mental health care and mental health treatment, What's the pathogen? What's the thing that causes the problem? Maybe it's the trauma. Maybe it's the culture you're in. Maybe it's something that you were just born with. There's so many ways of being in the world. So many different options of human variation. And our tendency as creatures is to say that which is different from me is bad.
Right.
That's a thing we do. So when we do that, we pathologize. If I am a cis-het guy walking down the street and I see two men kissing one another and something inside of me says, yuck, I don't want to do that. And then says, oh, that must be a bad thing. It's bad that they're kissing each other because I don't want to do that.
Right.
So the fact that they do is a sign that that's bad. That's pathologizing. And we do that with other human beings for all sorts of things all the time. And historically, it's been kind of tricky for people who practice mental health care to figure out, okay, what's actually a problem and what do people just say is a problem, right?
Right.
So a real hot button topic right now, and I just edited this episode, so it's on my mind. Trans people. Is it inherently pathological to be trans?
Right.
And human cultures throughout history have had very different answers to that question.
Right.
This is not the only time in history where trans people were considered sick, nor is it the only time in history where trans people were considered part of normal human variation.
Right.
Every culture addresses that differently. The same is true for how a particular mind works, right? If somebody comes to me and says, I'm hearing voices at night. When I go to bed, I hear voices. If my mind immediately goes, they're psychotic, hallucinations, I might be pathologizing something.
Right.
Because if I ask them, well, what are you hearing? And they say, I think I'm hearing my grandmother. She's singing me to sleep. And I say, oh, your grandmother, does she live with you? No, she died when I was 5. And I learned that this person is from a culture that believes that our ancestors are still with us, that our loved ones stay with us and do things like sing us to sleep. I can't just call that a pathological hallucination.
Right.
That's part of how that person exists in the world, informed largely by their culture. So one of the challenges of doing therapy with people is to resist pathologizing that which is different and trying to be genuinely curious about what's really going on here. I'm stealing that phrase from Roy Barsness. I'm in a training program that he runs. I'll interview him on this show someday, Roy. I promise I'll get to you. Not in season 1. But his famous question is the question of psychotherapy. What the hell is going on here anyway? My goal as a therapist is to help people live the best life they can.
Right.
And as much as I would want to, that idea, the best life they can, is something that I have thoughts and opinions about. It's not entirely based off of what they want. So it can get sticky, it can get tricky. But the main goal when diagnosing someone is to try to figure out what is causing you trouble in your life. And largely, trouble in someone's life is caused by A, their own subjective experience of suffering, and B, how much suffering they're bringing onto other people.
Right.
There's a lot of other ways to think about it, but that's the short version.
My question is, is a pathology specifically related to how a person or how a person's mind informs their interactions with society? Is there a difference between there's a person in this society who hates wearing pants. And so they walk around with no pants on. And in this society, that's a problem.
Right.
There are certain societies where that is not a problem. You would be the weird person for wearing pants.
Right. Yes.
But in this society, that's a problem. Therefore, that's a pathology. Versus you have suicidal ideation. And if you lived by yourself in the woods, that would still be a problem for you, even if there was no society.
Yep.
We would call those both pathologies or what?
Yeah.
I guess, is there a delineation there?
It depends on who you ask. For me, that nuance is important. Part of the trouble is that most diagnosis is according to the DSM. You might have heard reference, the Diagnostic Statistical Manual. It's produced by the American Psychological Association. It's the language of insurance. It's the language of the medical system. However, diagnoses in the DSM are not descriptions of what's wrong with a person. They're descriptions of a symptom. So if you took the way the DSM works and applied it to other forms of medicine, the DSM would be like if a doctor didn't diagnose you with the common cold or influenza or a MRSA infection, they just diagnosed you with fever disorder. That's how mental health diagnosing works.
Right.
Because people aren't diagnosed with having a repressed trauma that manifests itself in like obsessive compulsive behaviors. They're diagnosed with obsessive compulsive disorder.
Right.
Which could also be caused by being born with a particular neurological makeup. Like OCD is a great example because sometimes people can develop all of the symptoms of OCD from experiences they had in their life. It can be nurtured into you.
Right.
And OCD is a thing that happens to certain mammalian brains. It can happen to dogs. It can happen to monkeys.
Right, yeah.
Like, it's just part of our neurological system. Some people, it's just in there. And that's true for depression and anxiety, for PTSD. There's so many things that can cause these symptoms, but from insurance and for our medical system that we have, we don't diagnose based off of the cause, we diagnose based off of the effect.
Right.
Similarly, if you have a COVID infection and your fever has gone away, but you're still coughing and you're still testing positive for COVID, no doctor is going to say your COVID is cured because your fever is gone. But if you go to a therapist who can make your depressive symptoms reach a non-clinical level, then we say your depression has gone away.
Right.
And then insurance won't cover it anymore. And I practice a form of therapy that says that's stupid because it's actually coming from somewhere and it's important to get to that place to make change.
When you hear pathological in normal life outside of like any therapeutic setting, mostly you hear it as like a pejorative aimed at someone who someone disagrees with.
Right.
So there is kind of like the colloquial term as opposed to like a therapeutic term. For instance, you know, if you find a certain person's opinion about X, Y, or Z repugnant, then you will often find people calling them pathological in their thinking.
Right.
And I almost find it as just like a synonym for like someone who tends to scapegoat a particular kind of person or choose an outgroup and attribute a bunch of negative actions to them.
Yeah.
Or motivations. Like that's a really easy to spot in society example. But like we're talking more about people's minds, I guess, as opposed to just like a way to call someone out for stirring the pot, if you will.
Yeah, I mean, and that's part of the stickiness of this kind of work. I was recently exposed to the idea that racist jokes are actually a part of bonding. It's a bonding practice especially among white boys, young boys who are white, will use racist jokes as a way to bond together. And the theory behind that is we bond by defining our in-group, by saying you and I, we're together. We're a thing. We are the same. We share the similarity. And a great way to bond with an in-group is to say, well, those are the out-group.
Right.
We are not like them. Those people we can make fun of. Those people we can laugh at. But we are together, right? I had this experience at a training program. It was a multi-day retreat. And one of the evenings, there were some people sitting around telling racist jokes.
Wow.
And I was like, wow, these are full-grown adults. But they're bonding. And they're all white, so that helps too. Like, it's part of humanity to try to define the in-group and the out-group. Because if we have the in-group, we're safe.
Right.
So then this funny thing happens. Well, what if there's something about me that would risk my participation in the in-group? What if there's something about me that's not quite right? It could be my sexuality. It could be an impulse that I have. It could be a desire. But if it's a part of me and it risks my belonging with the group,
Right.
I'm going to deny that part. I'm going to chase it away. All my resistances will come up to say, nope,
Of
nope,
course.
nope,
Yeah.
nope. And one of the goals of psychoanalysis is to say, in this relationship between therapist and client, analyst and patient, provider and consumer, whatever language you want to use there, there is no out-group. There's a couple people in the room trying to allow space for everything that the client, patient, consumer brings and is.
Right.
And to allow room for that person to be as fully themselves as possible, including the things that could risk their expulsion from the in-group. That feeling that you have when a part of you comes up that could risk you being kicked out, that feeling is shame. And shame drives so much of human sickness, of human illness, of pathology.
Interesting.
That's part of my theory, at least.
What is it that you are hoping to get for people with this podcast? What are you hoping they'll get out of it?
What am I hoping people get out of this podcast? I do hope it's entertaining. Like, I do hope that these episodes are enjoyable to listen to. They were enjoyable conversations to have. So I hope that they're engaging to listen to. They're long, too. So I hope that people listen to them while doing otherwise mundane tasks, and that those tasks are slightly improved by listening to something interesting. On a deeper level, I hope two things. It's a twofold thing. I hope that each of these episodes leave the listener with a sense of expansiveness. And that expansiveness could be about their own sense of self, could be about their stance and attitude towards the world, could be about people that they know, people that they don't know or have been afraid to know. If you listen to this episode and now feel like you have access to a whole world that you could explore if you wanted to, then oh my God, I can die happy, right? Like, I'm not just calling it The Way In because that was the best idea that we came up with in our brainstorming session that you were at, Ben. You came up with the name The Way In, by the way. Yeah. That's you. That's on you. You did that.
And I feel good about winning.
Yeah, you should. But also it speaks to, like, yeah, that's what I want. I want to provide people with a way in to a topic or idea or a part of themselves that they previously didn't have a way into before.
Right.
Like, the goal is not to get somebody all the way to any kind of conclusion. The goal is to just open up a couple of doors for people to explore more deeply if they want to.
So one of the things I was interested in is, like, and maybe this is an opportunity for you to talk more about your particular practice, a bird's eye view of how you actually practice your therapy. Yeah. How do you see this podcast relating to the therapy that you help others through as a practitioner? Or does it not? I think your answer about expansiveness is probably as good of an answer as anyone could give, because that's kind of like saying you've gotten someone to a threshold that they previously hadn't seen or known existed. Yeah. And, like, there's so many options from there. And it is really tough, I think, especially the older you get, to find yourself at, like, new thresholds where you feel like possibilities are endless.
Right. Yeah.
But back to the original question, like, does this relate to your practice in any way, or is this sort of something completely separate?
Yeah, it's tricky because, to be honest, I think most of the people who listen to this show will probably be other therapists, because other therapists are the people who are interested in these topics, right? Like, that's probably what's going to happen. I hope that the episodes are approachable and accessible enough that they can suggest that their clients, friends, and family also listen to some episodes. But I think most of the people following it will be other therapists.
Yeah, they'll be the first line,
exactly.
You know, and then
if they disseminate it out farther, great. But realistically, that's most of the people who are going to be intrigued at this sort of thing. So for them, I hope that it's valuable. I hope that it's useful. I hope that a lot of therapists who listen to the show do check out the show notes, do click on further learning, do like say, okay, this is a thing I'm into. Let me keep diving into it. For somebody who's a client in psychotherapy, I hope that some of these episodes inspire some thoughts and some curiosity that you can bring to your therapist. If you are my client in therapy listening to this right now, first of all, please tell me you're doing that. Because I want to be prepared, because some of these I talk about my life and not everybody wants to hear that about their therapist. And then the other thing is, if questions come up or if there are moments in the conversation that strike you, talk to me about it. That's what I want. And I suspect that if you're not my client but do have a therapist, your therapist would say the same thing.
Right.
And I don't just mean like, oh, I was inspired by that. Oh, that felt expansive. I mean like, oh, I don't know how to feel about that, but it stuck with me. Or, oh, I didn't like that at all. Any big affective response, that's powerful. That's a way in. Affect is often the way into depth, the way into deeper stuff. I should define the word affect. Affect is another word for emotion, kind of. When we think of emotions, we think of things like happy, sad, excited, confused, lonely, right? Affect is the full embodied physical experience of a moment. So oftentimes affect is not processed yet. Emotion is more processed. Emotion is more defined. And oftentimes when you can get someone to have an emotional experience where they can say, yes, this is what I was feeling in that moment, it actually integrates a lot of dissociated and disconnected affects. So affect is like, my heart was beating faster and I felt disgusted and like I wanted to run away. Or I suddenly felt very sleepy and disconnected and I didn't care about anything. Those are descriptions of affect. And I am a believer in the power of affect. If you can take affect and move it into emotion, then you can take the unconscious and move it into the conscious, which is what psychoanalysis has been trying to do since, 18, whatever, 90 something. 60 some, I don't know, sometime.
That brings me to a couple terms that I had read about or heard about and were interested in. So we talked about pathology, we talked about the unconscious and having these affects, and then almost like we have an affect and then we ascribe a meaning or a emotion to it. Without any processing of this, it just happens most of the time. One of the terms I've heard used surrounding this is like the idea of ambivalence and contradiction.
Sure.
So the idea being that like in our subconscious, there is a lot of things going on that we're not aware of, but they all coexist. And one of the things that's strange, but also very human about these affects and these emotions that we ascribe to them is that often they can be contradictory to our, let's call it the superego or your conscience, let's say, or just contradictory in general. And like just the relationship between those things, because I feel like that can be incredibly confusing for a person going through intense feelings or intense emotions.
Yeah.
Like an aversion to something that they once loved could be an aversion of this. And I was wondering, does ambivalence relate to the thing you were talking about before where you want to bring people to a place where they feel open as if they're standing at, a new threshold with so many possibilities? Because to me, like, ambivalence is more or less a sign of a healthy mind. Well, just because as long as you're able to hold off on making any rash emotional judgments, you're probably doing better than most people.
Okay, so you've given me a very hilarious springboard, so I'm going to run with it. Okay. You say ambivalence is evidence of a healthy mind. I agree with you. And funnily enough, back in the day, ambivalence was a diagnostic criteria for schizophrenia. And
really?
What they meant by that wasn't the kind of ambivalence you're describing of being torn and finding yourself between two feelings. Their definition of ambivalence back in the day, this is like, 20s, 30s, was if you have someone who is diagnosed with paranoid schizophrenia and you talk to them and you say, hey, what do you think about your therapist? And they will tell you, I really like my therapist. It's like the one person I can trust. I can be open with them. Everything's good between me and my therapist. And then you talk a little bit more and you ask them about how the CIA is watching them. That's their delusion. And they'll say, yeah, the CIA is watching me. And you know what? I know my therapist sends them the recordings of our sessions. I know he does.
Right.
Wow.
That's the ambivalence. Because on the one hand, the person with schizophrenia is saying, like, arguably, they're more relationally oriented self, their more securely attached self is saying, I can trust this person. I feel safe with them. I can work through my feelings with them. And then their paranoid self state, that's a little bit psychotic, says they're wrapped up in the conspiracy just like everyone else, right? And both things are held as equally true, even though they're inherently contradictory. Right. And we flip back and forth between them. Right?
Simultaneous trust and distrust.
Exactly. Yeah. And there is no tension. That's the thing about the ambivalence in this psychotic way. There's no tension held between it. It's either one or the other, and it switches moment to moment. And if you're ever in a conversation with someone who's at that level of mental functioning, it's really disorienting because they will tell you a particular thing about them that you're like, okay, this is how we feel about this thing. And then all of a sudden, boom, we feel the opposite. And I'm like, oh, shit, what happened? Right?
Yeah.
So that's the thing about ambivalence. What you're speaking to, I make sense of, again, through multiple self states. We all contain multitudes. And being that we contain multitudes, we also contain contradiction. Psychoanalysis is a theory of conflict. Going back to the beginning was the idea that there are conflicts inside of our minds that we're not aware of. We've talked about the unconscious. Most people are probably familiar with it. You might think about the iceberg image of the unconscious. But to very, very simplify it, most of what happens in your mind you're not thinking about. Breath is the best example. Now that I've mentioned it, listener, you might be thinking about your breath. Yeah, it's funky, isn't it? When something that's unconscious becomes conscious. Most of the time, most of our emotional functioning, memory coding, heart rate, physiological checking in awareness, all this stuff happens without our conscious, thoughtful awareness of it. Right. But we can draw our attention to those things and become more aware. Breath is a great example, because if you notice that you are hyperventilating, and you focus on your breathing, you can slow it down, which can help prevent or reduce the severity of a panic attack. Right. Or if you're trying to sing, focusing on when and how deeply to breathe is very important to be able to breathe well. Sometimes you want to be aware of your unconscious processes. So if there's something deep in your mind that's causing a conflict and there's an ambivalence, the goal is to bring those different parts of you, those conflicting parts of you, into awareness enough that you feel the tension, that those things can have the conflict instead of just taking over one over the other, that you can tolerate the tension enough to integrate, to come to a point where those different parts of you can be in dialogue without it feeling painful. And sometimes help from another person is very useful for that.
That's interesting.
Yeah,
I'm
interesting.
picturing the Starship Enterprise when you're talking about the conscious and unconscious mind. And it's like the conscious mind is the bridge.
Yeah.
Right? And sometimes the bridge is like, where are we going? What are we doing? We're going to talk to the aliens on the other ship. And sometimes the bridge is like, we need to call engineering and see what's going on in engineering. Yeah. And like there's thousands of people on that ship doing jobs and doing important things and carrying out tasks that need to be done. And like, they're making choices and changing systems. And we're like, okay, well, this needs to adapt. And like those things are just happening. The bridge isn't paying attention to them because there's systems for that. Right.
Yeah.
And those are all really important systems. Like the food replicators still work. And like the warp drive can warp. And like all the stuff is like, yeah, people can beam to other places because people are doing jobs and doing important things. But the captain doesn't need to be looking at that for it to happen.
Right.
Just like our brain doesn't have to be like, oh, I need to make sure the nerves in my hands still feel things when I touch that wall, you know?
Yeah.
That's the metaphor.
Yep.
I don't know if we need another metaphor. But
no, I love it. That's a good one. I'm taking that one too.
So it sounds like we have to become ambivalent about the word ambivalence in the sense that, like, you know, it can be interpreted in a negative way depending on how the contradictions show themselves. Like you're talking about this tension growing between two potentially opposed ideas or whatever. If all you feel is tension, that's probably something that you've pathologized.
Yeah.
And if you are able to stand back and feel the tension, see the tension, notice it, just be conscious of that ambivalence, that would be like the healthy version.
Well, that would be a version that was aimed towards health, I think. The way that I think about health is something that we are aimed towards. It's not something that we ever like achieve. I don't think you can ever say, I did it, I'm done. In the same way that bodily health functions that way, right? If you reach a point of like peak physical fitness and then you're like, great, I'm done, and you never exercise again and like only eat carbohydrates and don't give your body the proteins and minerals and vitamins it needs, hey, it's going to break down, right? Nothing about human life or human flourishing is static. I think wellness and health is something that we aim towards and pursue in how we are in the world. It's not a thing that we achieve and then have granted to us. So I think that to continue this conversation about ambivalence, the wellness orientation that you can have is to say, like, I feel a tension inside of myself and I'm doing my best to not collapse into one side or the other because the tension hurts. I'm trying to stay with the tension because the tension is telling me something important about a conflict inside of me. And I don't think that you can live a human life without tension. I think when we try to, we end up depressed or highly anxious or dissociated or complacent. I don't think we end up living well lives or full lives without tension. And relationally, interpersonally, we need to be able to acknowledge the difference between us as much as the similarity, right? We are all more human than otherwise. That's some psychoanalyst. That might be Sullivan. More human than otherwise. That's what everybody is. And without acknowledging the reality that you and I are different and experience the world differently and have meaningful differences between us, we're never actually going to get to know each other. So somehow we have to hold the idea that we are more similar than different, and our differences are super important. And we need to respect those things and be curious about them.
Yeah, otherwise we descend into fascism. Obviously.
I mean, I'm glad you said it, because in other episodes I say it. So.
The way you fall in. I feel like I need to make you another bump, which is this word means different things to us.
Oh,
because
yeah.
ambivalence has a related but very different meaning for like the average everyday user. Like when a therapist or a therapist speaking person says ambivalence, they mean feeling very strongly both ways about a thing. Whereas when like I talking to my partner about what to get for dinner, should it be burgers or pad thai, and I don't have an opinion, say I'm ambivalent, that doesn't mean I want burgers and pad thai so bad that it's tearing me apart.
Right.
I wouldn't say I'm ambivalent about it if I feel strong.
Right.
I'd say I'm torn.
Right. Yeah.
Like,
yeah.
If I'm like, I don't care.
Right.
Either way. I don't have a strong enough opinion, positive or negative. I'm ambivalent. It's related, but it's a totally different word.
Absolutely. I think a great example of that is the word ego. Because in common parlance, in common language, ego is like essentially someone's like self-regard. Like how great does someone think they are? If someone has a big ego, then wow, they think really highly of themselves. Right. But in the world of psychoanalysis, ego just means it means self. Interestingly, when Freud was originally writing about id, ego, and superego, he wasn't doing so in English, he was doing so in German. And he didn't use those Latin phrases. He used the German words of ich, self, I, me. That was the word he used.
Yeah.
And then English translators wanted to make it sound more highfalutin, so they used the Latin ego, self. So in psychoanalysis, when we talk about ego, self objects, we're talking just about a sense of self. That's all that we mean. We mean the thing that they feel the most is true of them. In the same way that someone's conscience often feels like something that's a little bit separate, but also inside of you. The superego, the thing above me, Über-Ich, right? The thing above me that tells me what to do. And then Freud also talked about the id. I don't know the word in German, but he just said the it, the thing that is inside of me that doesn't feel like a person. It just feels like a drive. It just feels like a thing that I need. Maybe it's monstrous, or maybe it's just persistent, right? So
the reptile brain, the instinct.
Right. Yes. Gosh, we're getting into Freudian theory. If you like this, the next episode will be freaking great. But all that to say, like, going back to the earliest days of psychoanalytic theory, not only was the language intentionally obfuscated, intentionally made to be more confusing and more academic than the initial writers meant it, but also the language got picked up by broader culture to mean their own things, right? Culture uses language from different intellectual traditions and then builds its own thing out of it. That's not bad, right? Like, the people who are saying that guy has a big ego, when I, as a therapist, might say, actually, their ego is pretty weak. They're just narcissistic, which inherently means that their ego is weak. That doesn't mean that that person who says that guy has a big ego is wrong. It just means they're not speaking the language of psychoanalysis.
Right.
In the same way that, we aren't wrong for calling cooked cow beef.
Right.
Because that comes from French when our language was originally Germanic. We don't call it cow, we call it beef because at some point all of our food words became French instead of Germanic because the English language is funny.
Yeah, because the Normans ruled England for a long time. Yeah,
Right. This is such a digression. How can I simplify this?
I love it.
When we use words differently in psychoanalysis, the psychoanalytic meaning is not the right one.
Mm-hmm.
It's just the one that we use to try to understand how people work.
Right.
And that's what I want my listeners to hear. For the love of God, listener, please do not listen to any of these episodes and then go home and then tell your roommates that they've been using words wrong. If you do that, then I have failed and I can no longer die happy.
Well, it's like the analysis that jumps to mind, which shouldn't be as far away from people's understanding, is like, if you're like, how much does that weigh? And you say 5 kilograms.
Right.
A kilogram is not a measurement of weight.
Right.
It's a measurement of mass. And if you
Right.
put something on a scale and it says kilograms, that's because your scale is dividing by the acceleration of gravity.
Right. Yep,
Like,
yep.
It's measuring newtons and calculating you kilograms to estimate its mass. But that's fine because we live in like a constant gravity state and like it works. It's a stand-in. And that's like, well, how massive is that? It's 5 pounds. No, you actually need to measure that in slugs. Like, no. Yes, the imperial unit for mass is a slug. It's the worst thing. Actually, the worst thing is also that people use kilopounds as a unit. That's also the worst thing. The imperial units should be a band. Metric makes sense, and that's all I need. Anyway, that's not the point. We've taken like the kilogram, and it's no longer a unit of mass because it's easier to use it as a measurement of weight because it's multiplied by a constant.
Right.
And so like the ego is like a thing that we talk about. If like that person has too much pride.
I don't know if anyone's ever successfully explained that to me until now, Ben. So thank you.
Thank you, Ben. Yeah, same.
Well, I was going to start my own podcast, which is just this for science.
Yeah.
But like the ego is like, oh man, that guy has a huge ego. And saying that guy has a huge I actually does make sense.
Yeah,
Like,
it really does.
oh, Zaphod Beeblebrox's ego is the size of the galaxy. Like that makes sense. His personhood is so big that like it can't be impinged upon.
Right.
But like it's important to acknowledge that in a different language context, that word is going to carry completely different connotations.
Exactly.
Yeah.
We can officially stop the recording now because you've made a Hitchhiker's Guide reference. So we've
true.
done it. But yeah, no, that's a really, really good analogy.
I had a follow-up question to the question I started like 25 minutes ago. So the initial question was, what are you hoping people get out of this podcast? And my follow-up question is there anything that you want people to not expect to get from this podcast?
Closure. None of these episodes are going to leave you with a sense of having completed something. Is at least my hope. If you leave one of these episodes feeling satisfied, I hope it's in the way that reading the first chapter of a book might leave you satisfied, right? I don't want closure. I don't want certainty, nor do I want people to leave with a feeling that anyone on this show thinks that they know what they're talking about in a way that's talking down to you. My hope would be that people hear these conversations as constantly evolving conversations, as dialogues between people who are trying to explain their mind about a thing with the understanding that the mind itself is constantly changing. The goal of this is not to like hand you the stone tablets upon which God has written with his own finger, right? The goal is to instead say, here's part of how I do this. Here's part of how I think with this. Here's part of how I roll with this. Here's part of how I think about this.
I think you kind of just answered another question that I had. The subtitle of the podcast, as it stands now, is Psychotherapy Demystified.
Yeah.
And I was interested in like what you meant by demystified and what the utility of demystifying things is, you know, in order to be ambivalent about all this.
Yeah.
Isn't there some utility to mystification?
Sure.
Broadly speaking, life itself is confusing and harried, and ain't that just the way it's going to be, kind of?
Sure.
And I guess, like, yeah, you answering it that way kind of gets to the point.
Well, and I want to speak to that. I want Psychotherapy Demystified as a subtitle, in part because one of you two, I think it was Dan, said like, if without the subtitle, The Way In sounds like a podcast about hiking, which like, fair. So psychotherapy demystified makes it a little more clear what I'm up to. So there's that. And one of my favorite psychoanalytic thinkers who's currently living is Michael Eigen, and one of his books is called The Psychoanalytic Mystic, right? So like, no, I am not opposed to mysticism, clearly. I was in a training a couple years back where people were talking about how uncontrollable psychotherapy is. How sometimes you just have these moments where like it works. Something has been happening in the background, in the unconscious space, and all of a sudden it comes to fruition and like the thing is here. And people were stating something along the lines of, it just happens. It's like the wind. You can't control it. It's just there and you can be open to it, but like you can't make it happen. And I pushed back on them because what they were describing was a transcendent experience. And actually, we know how to induce transcendent experiences. Like temples and churches and cathedrals share similar elements of architecture.
And rock clubs. Yes, actually. Because being in a place with a very high ceiling that is still contained makes you feel closer to transcendence. Because being in a room where the acoustics are right and you're with a bunch of other people who are all breathing in unison and their heartbeats are syncing up engenders a sense of euphoria and belonging that makes a human being suddenly feel connected to their community in a way that shakes somebody up. Sacred architecture is a thing. Sacred ritual is a thing. And in psychotherapy, we practice both of those. We set up our offices to be spaces where people feel comfortable in. We set up the starting and ending of our sessions to be predictable and consistent in a way that contains the work as much as we can. And we practice how we engage with our clients in a way that's meant to bring people and invite people into the space where something new can happen. I think that right there is probably one of the highest goals that I have in therapy. Let's try to make something new happen. The value of demystifying psychotherapy is to explain things like how you build a cathedral. Because when you think God just did it, that causes all sorts of trouble. The value of demystifying psychoanalytic concepts are that, as you'll hear, listener, in a later episode, some of these ideas can be really useful for getting through troubling times. And if you have access to these things, great, make use of them. And so I want people to have access. I don't think that knowing how a magic trick worked ruins my delight and surprise in being tricked. If anything, it just makes me more interested in being tricked again. And I hope that this show does something similar with the various tricks, the techniques, the ideas, the ways of thinking that are available in psychoanalysis, in psychotherapy, and in psychiatry.
That's great.
Did we do it?
I felt like that ended well. I didn't say anything because I was like, wanted to give you a good edit point.
Yeah, same.
Okay, well, fine. In that case, Ben, Dan, where can people find you that you would like to be found?
Great question. Well, if you like the music I made for this podcast, I don't really do anything else like that. But I did make the music for Trash Food for Garbage People, which you can listen to if you'd like.
And you are in a band.
And I'm in a band, which is not like the music I made for this podcast either, but it is very fun. So if you want to check out the Hoot Hoots, you can check out the Hoot Hoots. Also, I was in a band with Dan for a while.
Oh, yeah.
If you want to find Saliva Giant on Bandcamp, there is one brief and very enjoyable album of Monster Punk featuring both me and Dan. So
that's right. I'd forgotten about that.
I missed that band. That was a good time.
Links in the show notes.
It's where I met my partner of like almost 10 years.
Oh, shit,
Our
that's
first
right.
show,
You guys met at your show?
It was our second show. Well, we re-met.
That's great. Links
so
to
cool.
all of the above in the show notes. Do you want people to like, I don't know, are you like on Twitter or something? Are you on Threads? Do you want people to follow you on social media?
Not really.
Good.
I have a private Instagram page that I almost never post to. End of list.
And your Be Real is really good.
Oh yeah, I am on Be Real. Don't follow me there.
Don't
either.
do that. It's just the cat anyway.
Yeah, it's mostly just my cat.
Yeah.
I should have an Instagram for my cat, but I don't. So,
Oh, well. Dan, what do you want to plug?
Yeah, in general, I don't really do much social media these days, but I have been cajoled into creating a Bandcamp for a musical project that's essentially just a solo project.
I did the cajoling.
Yeah. And there's some music on there. I plan on adding more. Before the end of this year, there should be a full-length album. Right now, it's kind of just a collection of singles, about 5 or 6. And some of those songs are psychoanalytically or psychotherapeutically motivated, I would say. Like, I have little descriptions and things like that accompanying the lyrics. So that might be fun to dive into.
I think that every song that you've written so far has been a deeply psychoanalytically informed song. I think you're doing psychoanalytic art, but I'm prejudiced.
Yeah, and I mean, honestly, I do hope that the album carries that. It has a lot to do with just coping with the last 4 or 5 years of my life, and how could it not be somewhat psychoanalytically informed after all that? So
Yeah.
that's probably the only place I'd really have.
And what's your Bandcamp called?
Oh, right, Sun Stitches.
Great.
It's spelt just like it sounds. It's one word.
Link in the show notes.
Yeah, and other than that, just check the show notes, and I might have a link to some art, but otherwise, just listen to the podcast, and you'll see more of it.
Yep.
So,
All right. Well, listener, if you made it all the way through to the end of this, great. Thank you. I hope this was enjoyable. I hope this was a good orientation to the show and kind of where I'm coming from and what we'll be up to. You will be hearing more from Ben and Dan in the future, I believe. We got some ideas coming up. And I hope that you enjoy this first season. I would love to get any feedback that you have. Ben, Dan, thank you so much for your contributions to this thing that I wanted to make. I think that both of you have skills and talents that I do not have, and am very, very grateful for being able to make use of them, that you've lent them to this project that I'm doing.
absolutely.
I really, really appreciate that you're here. And thanks for coming along with me. And listener, thank you too. Because without you, this wouldn't exist. That's not true. Without you, I would still make this and just keep it on a hard drive just for myself. But without you, it wouldn't be public. So thanks you too. Special thanks to Ben Lewis and Dan Lane. You'll be hearing more from them later on. In the meantime, links to their various creative projects can be found, of course, in the show notes. Thank you for listening to this introductory episode to the podcast. Future episodes will take on a more traditional interview format, but I hope that this episode did a good job of setting up some of the structure and philosophy that I'm bringing to this project. Our next episode will be up in 1 week, and that will be my conversation with Daniel Benvenisti on the topic of Sigmund Freud and his legacy. This has been The Way In. This show is hosted and produced by me, Tyson Connor, with music by Ben Lewis and visual art by Dan Lane. If you enjoyed this show, please rate, review, subscribe, follow, like, share, star, heart, reblog, retweet, repost, upvote, or in some meaningful way engage with the episode on your digital platform of choice. I'm told it makes a big difference for exposing more people to the show. And if you think someone you know may like this episode, you could also just tell them about it. You can follow the show on social media, where we are at The Way In Pod. There you can give me feedback, tell me a joke, and see high-resolution versions of the individual episode art, which I highly recommend. I think Dan did a great job. Thank you for joining us. Until next time.
it is funny that we make that mistake constantly when deciding on what to eat, because people will just be like, I don't care. And then you make a decision and they
That could also be because we're all in denial about our own desires.
It could be a whole branch of therapy just to making the choices about food.
DoorDash therapy.